Welcome back, everybody. I think so far we're managing with our new platform, so we haven't lost you all, so that's a really good thing to see. So thanks very much for staying to this session. As Dr. Atherton has mentioned, we're going to talk now about the two reports that were commissioned by Welsh Government earlier this year. I'd like to introduce our speaker, Dr. Kit Chalmers. Now, I've known Kit for quite a few years because she was an intensivist in Llanglwyd Hospital in North Wales and shared the link that Llanglwyd Hospital had with Ethiopia, and has done a tremendous amount of good work that way. So she really understands what getting involved in a health partnership is about. And then last year, when the Welsh Government commissioned a review into Welsh Health Partnerships, we sought a researcher to carry out the review, and Kit popped up and did an absolutely tremendous job in 3 months with looking at Welsh Health Partnership activity. The report was well received by Welsh Government, and they then went back and asked THET and Kit to carry out a wider review of all international health activity. So that was the second report that was completed in May. So they have now been launched in the last couple of days in the public domain. So I think Kit's put the links in the last session to the reports. We'll put that in again in the chat. So do go and have a read of those. There are brief executive summaries to get the gist of them, but most of you will probably be interested in looking at the detail in those reports. It gives us a lot of food for thought, and I'm delighted that Kit's here today to present the findings. Kit has now gone on to be the Head of Policy and Learning for THET, the Tropical Health and the Education Trust. So it's great to have a Welsh ally embedded within THET, and she's certainly been hugely supportive to the Wales and Africa Health Links Network. So I'm delighted to hand the floor to you, Kit.
Thank you, Catherine, and thank you for inviting me to present the reports. Peter's sharing my slides for me, so Pete, since Catherine's already done the introduction, I could have my next slide, which is really just to say how I'm going to structure this this talk. So I'm just going to give a bit of background about the projects, and in fact Catherine has already. A little bit of background about Wales and its interaction with global health. And then I'm going to structure the findings of the report around some of the key recommendations. And I'm focusing particularly on the report about Wales and Africa and its health links, but we'll draw in information from the wider report as well, where it fits, obviously, given this audience. And then hopefully there'll be plenty of time for discussion at the end. So if we could move on to the next slide. As Catherine's already mentioned, so there are two reports that we've carried out this year. The first was really the brainchild of the Wales and Africa Health Links Network, and grateful that Welsh Government picked that up and funded the review. Done in the first 3 months of this year, so obviously it's taken a little while to work its way through and become published. And that was looking particularly at health partnerships, or health links as we often call them in Wales, and also Wales's civil society organisations. I'm introducing my abbreviations here, so CSOs. So the organisations who are based within communities but have close and long-standing links with communities or organisations in Africa. And again, looking particularly at Africa, given Wales's focus of funding through the Wales and Africa programme. And the report looks particularly at the capacity of those organisations, the funding that they're accessing, with a bit of focus on whether and how they can access UK aid, which is Official Development Assistance, or ODA, and the supporting environment surrounding those organisations. Next slide, please. The second report, as Catherine mentioned, we were approached to carry out and is a much wider review, looking at Wales's international activity in the round. So in all its 4 sectors, so the public sector, that's the NHS and the government, the academic sector, so our universities really, commercial sector and the non-profit sector, which have been largely covered in the previous review, but obviously including only Africa. And looking at healthcare, but also life sciences, so really quite broadly at how Wales is active in health in an international arena, and looking at how that aligns with Wales's key policies and legislation in order that the benefits of what is going on can be maximised again. If we can move on to the next slide again. So I was encouraged by Catherine to include a bit of background about Wales, which I feel slightly shy about, given that this is a largely Welsh audience. And as you can tell from my accent, I'm not originally Welsh, but I do live in Llandudno, dysgwyr Cymraeg ydw i, and I am very passionate about Wales's role in the world. And I know there are people here from other parts of the UK and also across the globe. So if we move on to the next slide, a little bit about Wales. This is not a potted history, it's really some random facts which I think fit into Wales's international health activity. So the picture of the castle represents Wales's colonisation in the 13th century by the English, which left us, certainly in the north of Wales, with a legacy of some beautiful castles which were used to oppress the Welsh but now attract tourists and hence economy to North Wales. And the fact that Wales managed to preserve its culture and its heritage and its language despite that is a triumph and shows the strength of the Welsh spirit, I think. Centuries later, Wales took part in Britain's colonisation of the world, in a sense, and this is a picture of one of Wales's slate mines, one of Wales's great industries. In the 19th century, Wales was said to be roofing the world by exporting slates all over the world, and of course the coal industry was also incredibly important. And the point of this, in a sense, is that the loss of these industries has contributed to huge pockets of deprivation and the health inequalities that go along with that are part of the health landscape in Wales. Next slide, please. This is a picture of the Tredegar Medical Society, which was founded in one of Wales's mining towns, the town in which Aneurin Bevan was lived and was MP, and it inspired him to launch the NHS in the UK in 1948. So the medical association was paid for by the citizens of the town, largely miners who contributed a small amount of their pay in order to receive care which was free at the point of delivery, which is how the NHS still works, of course. And then again, much later, so in 1997, Wales voted for devolution. We now have our Senedd, our own parliament, and control over many aspects of law and culture and society in Wales. One of which, next slide please, of course, is our healthcare system. Which is different from the healthcare system of England, Scotland and Northern Ireland. We each have our own. In Wales, there are 7 health boards and many representatives of those here, which provide both primary and secondary care. There are 3 trusts which cover the whole of Wales. That's Public Health Wales, the Lindra, which is cancer care, and the Welsh Ambulance Service Trust. And 2 special health authorities, so Health Education and Improvement Wales, which is relatively new and is about educating and managing the workforce of the NHS, and Digital Health and Care Wales, which deals with its technology. Next slide, please. And of course, and some of this has been alluded to as well, Wales has a long history of being involved in global health, and this is just the recent history, but in 2006, not only was the Wales and Africa programme launched and the Wales and Africa Health Links Network came into being, but also the Welsh Health Circular, which was sent by Wales's Chief Medical Officer, encouraged health boards, or required health boards really, to become involved in international health links and to support staff. And it's sad to see, although not surprising, the comment that health boards are not supporting their staff in taking leave for this type of activity, because that was one of the provisions of the Welsh Health Circular, that staff would be supported to take part and it would be counted as continuing professional development. That was taken further with the Enabling Framework for International Health Engagement, which set up the International Health Coordination Centre as part of Public Health Wales, initially funded separately, though but no longer so, and went further in suggesting ways in which Wales could become systematically involved in this sort of activity. And the International Health Coordination Centre developed the Charter for International Health Partnerships, 2 of which, as our Chief Medical Officer has said, all NHS health boards in Wales are signed up to, as are most of the special health authorities and trusts. Then in 2015 came the world-leading really legislation on sustainability in the form of the Wellbeing of Future Generations Act, one goal of which is global citizenship. And in 2020, an international strategy for Wales. So there's a huge background of being involved in international health, and these reports, if we go on to the next slide please, are really aimed at, it's the Welsh Government's aim at looking at where we're at the moment in terms of that and how we can take things forward and do better. I'm not at all going to go into detail on the methodology, but essentially they were carried out by a researcher, the first one, really just me. The second one, I was joined by Bernard O'Kea, who's based in Bangor and also part of a health link up there. And both reports were led by steering groups of experts in their field related to the work. We carried out desk-based research of publications, grey literature, THET databases, for example, and online surveys. And I'm sure many of you here contributed to perhaps one too many online surveys, so thank you for that. Lots and lots of informal discussions. And again, I will have spoken to many of you here, as well as to stakeholder interviews. Around about 50 probably between the two reports. The surveys and the interviews, I think, as well as everything else, showed the general enthusiasm and engagement of the different communities with this, and over 70% of people who I approached to take part in an interview took that up and contributed to these reports. There are certainly limitations, the main one of which, of course, being time, and the second report particularly, which was carried out in only 2 months. And so they are rather long, but they are not and cannot be exhaustive. So if you look at the reports and see that you're doing good work that's not included, I do apologise, but they can't possibly be exhaustive, and I hope they've captured enough to give a good overview and flavour of what's going on. Next slide, please. So I've picked out what seem to be the most important and relevant recommendations for this audience, and I'm going to justify the recommendations with some of the findings and present the findings to you in that way. So if we move on to the next slide, I've put these two together. So this is about the organisations who are involved and their funding. So there's a recommendation to Welsh Government that they work to build the capacity and sustainability of existing organisations, those health partnerships, those civil society organisations, and also that Welsh Government strengthens the strategic relationships that it already has with key UK government departments and networks, including the FCDO. If we move on, that's because of the information gathered during this report. So 38 Wales and Africa related organisations identified, 10 of those affiliated with the NHS, 2 with universities, and 28 within civil society. So lots and lots of activity. But given that we've got 7 health boards and 3 trusts, to find only 10 official NHS affiliated health partnerships was slightly disappointing, particularly given the amount of supporting legislation and policy that we know exists. Expanding the scope to all countries in the second report, that increased to 94 organisations, and some of these, of course, are small links, and there's much more informal work going on. So again, I say I can't hope to have captured everything here. But these organisations are very small. So the table, which is probably not very visible on this platform, categorises those organisations by income, and over 50% of those, that's the 38, 50% of the 38 would be categorised as small or micro, with an income of less than £100,000 a year. And the idea of smallness came through so many discussions in so many areas, partly as an advantage. So Wales is a small country, and that was highlighted as a major advantage for all of the sectors, really, that there are good connections between different organisations and right up to Welsh Government. but also that in being small organisations, it's difficult to have the time, the capacity, the skill to apply for larger pots of funding, which might allow more work to take place and might develop the capacity that organisations need to take things further. And I would say at this point that I'm not presenting here about the impact of this work on other countries and on our partners overseas, because that's not what the report set out to do. But of course, the whole point of all of this is to be doing useful, impactful work that is beneficial to our partners as well as to us. And I come on to the benefits to Wales a bit later. Next slide, please. Looking at how these organisations are funded, and again, it's the 38 mentioned in the previous slide. In terms of the biggest source of funds, the biggest source of funds for most of these organisations is direct donations. So as in a button on a website or a shaking a can somewhere pre-COVID days, followed by Wales and Africa grants. And in fact, looking at it a bit of a different way, 85% of organisations access Wales and Africa grants, or those who answered the survey, which is about half of those groups. Followed by other sources, including fundraising activities and grants from official development assistance sources, but very few of those. So over 5 years, only 8, I'm calling them health links, so of those 38 organisations, accessed about £1.5 million worth of ODA funding. Universities, of course, are used to putting in funding bids and access much more, around 15 million. And again, there may be much more that I've not found. But even if those figures are doubled or tripled, they're a drop in the ocean of what was, before the ODA cuts this year, about £15 billion worth of ODA funding per year for the whole of the UK. Next slide, please. So the barriers to accessing that funding, and this already feels a little out of date because this funding has reduced so substantially this year. There's been a sort of cut of a third or more in ODA funding as the UK government has decreased its contribution from 0.7 to 0.5% of gross national income. However, still money to access in order to benefit our partners overseas. So some of the barriers are political. So England historically plays a key role in distributing and guiding how that ODA is spent through UK government departments. England's chief medical officer leads the relationship with the WHO. Public Health England tends to sit in many of the important roles in groups that deal with that funding. Although with the changes at Public Health England, that is also changing, and Wales may have more of a seat at the table there. And of course, there are limitations in terms of what Wales is allowed to do under its devolution settlement, and Wales is not allowed to allocate its own ODA funding for the benefit of other countries. That spending is controlled by the UK government, which is why the relationships are so important. Then there's the organisational capacity, as I've already discussed. So accessing these funds is a lot of work, and I spoke to many organisations, or those organisations who had managed to access that, and they spoke of the difficulties of doing that in terms of the requirements for the grants. Time is needed, skills are needed. Our organisations in Wales who have paid staff often have only 1 or 2 whole-time equivalents, and even that makes it difficult. So the groups that function solely on voluntary contributions are at an immediate disadvantage for accessing these funds. And then there's the coordination and strategy which lies behind that, because joining with other groups and making connections between sectors is incredibly helpful in developing the sort of projects that can attract major funding. And without good coordination and without strategy to guide where people should be focusing their efforts, again, we're at a disadvantage. Next slide, please. And yet Wales has huge strengths for attracting official development assistance funding, and this really translates beyond funding certainly to Wales's general strengths. And this table is from the first report, but is very much borne out by findings from the second report as well. So Wales is world leading in areas that are of interest globally, and in many cases have connections globally through them. So we're a world leader in value-based healthcare, recognised in international forums and with good connections through that. Public Health Wales has a very strong track record. It's managed the pandemic extremely well. It's been able to leverage its genomic sequencing to a huge extent. We have fantastic innovation and structures which support innovation in digital and other areas. We have fantastic clinical education, and Frank has already talked about the midwifery WHO collaborating centre. And again, in terms of health protection and Public Health Wales has a WHO collaborating centre, both of those with the European region. We have strong connections with countries which may support ODA funding. So Somaliland, we have a huge Somaliland population. Somaliland itself not recognised for ODA funding separately from Somalia, but part of the East Africa region that the UK government wishes to focus on now, as is Uganda. And of course, our strongest connections are with Lesotho, which Wales has been partnering with since at least 1985. Next slide, please. And I didn't highlight, but in that table were a number of other organisations outside of NHS Wales, often outside of academia, that are involved in that type of work, which brings us on to the next recommendation, which I think follows naturally from all of that, which is that Welsh Government needs to review and reinvest in the coordination of international health work. So that will support generation of ideas, generation of collaborations. It will foster the ability to share skills and pool skills so that individual groups with low capacity can share what they have got and put together the types of projects which we and our partners need and attract the funding for that. Next slide, please. So this you won't be able to see the details of, and you're not really supposed to be able to see the details of them. The point is just to show how complicated the situation is already. So this is just thinking about the Wales Africa Health Links Health Partnerships community. At the top of that are the two government departments that are involved in that. The bottom left in blue is the NHS. To the right in the green is the civil society, and there are sort of three organisations at the moment that play a part in coordinating that. Some of which, of course, you're very well aware of. So Hub Cymru Africa is over on the right. So Hub Cymru Africa dealing with all of international development in a sense for Wales, certainly in terms of Wales and Africa work. On the left is the International Health Coordination Centre, which was least known, I think, amongst the participants, the stakeholders that I spoke to, because it's very much involved in the NHS work. So that coordinates the health boards to some extent through the Charter Implementation Group. And then in the middle of those is the Wales and Africa Health Links Network, which is a partner of Hub Cymru Africa, but run by volunteers, many of whom are healthcare professionals, so also very closely involved with the NHS, so positioned quite well between the NHS end of things and civil society and international development. Next slide, please. And of course, in the other sectors as well, there is huge activity. And just to highlight within the academic sector, looking at collaborative health publications. So this is where we expand right out and just look at what is Wales doing in terms of health internationally. And part of that is collaborating with others on health-related studies, which then translate across borders. And a search of 2015 to 21 found that Wales's 8 universities have collaborated or co-published with 4,000 institutions in 142 countries. across all continents. The most common being in Australia, Europe, and the USA, but also connections elsewhere across the world. And of course, academia has to have close links with the commercial sector, because in many cases, the research that's taking place leads to commercial developments, new equipment, new programs, etc. And those links between academia and the commercial sector are extremely important. And research, of course, is also going on in the NHS, and our Chief Medical Officer has described the funds that go to that. Looking at this raises the issue of the difference between overall international activity, which that graph and figures are describing, and global health, which I think is more what we're thinking about here. So global health, focusing on issues of health and health systems that are important in other countries. So that might be different diseases, it might be organisation, it might be the healthcare workforce and their training. And many of Wales's academic institutions are involved in global health. So lots of international activity, but lots of global health, and that's spread across the country. So Aberystwyth is working on some things within its geography department, in fact, looking at flood patterns which affect malaria. Cardiff is working through the Phoenix project on more practical sort of implementation research. So lots of different things going on, and going on right across the country. Next slide, please. And again, you're not supposed to be able to read this table, which is just as well, because you won't be able to, but it's looking at the Welsh Government itself and the different departments and groups within those departments which have a bearing on Wales's international health activity. And there are 4 different departments there, and within those 2 or 3 different groups each, all taking part in various aspects of Wales's international health activity within academia, the NHS, and so on. So if we move on to the next slide, please. I hope that explains why a recommendation that's in both reports, in fact, separately, is for Welsh Government to convene a cross-government international health strategy group. Because it's clear to me, speaking to, and I spoke to many people across Welsh Government, that they're aware of what each other are doing, and they signposted me to their colleagues who are involved in different areas. But in terms of an overall strategy and oversight, the whole work will be greatly strengthened by bringing those people together and focusing on where Wales's international health activity should be focused. And that came up in terms of strategy time and again in discussions with stakeholders for both reports, that there's not a clear guidance or strategy on where efforts should be focused, and developing that will help bring people together and support those collaborations that can produce really strong work and useful work. Next slide, please. And finally, really, for the NHS, so there are some recommendations specifically for the NHS, and Welsh Government plays a role in this, of course. One is that the NHS embeds international work into its core business, and it can use the Wellbeing of Future Generations Act to support that. And the other is that the global engagement of health education and improvement Wales is strengthened. So moving on to the next slide. The NHS is involved internationally in many ways, and not on this slide, but of course there's much international research going on, there's innovation going on that requires international connections. Going back to the first report, we found those 10 NHS affiliated health partnerships, so a relatively low number. In the second report, looking outside of Africa, there are many other connections and much other work going on. Quite a lot of that is informal, and this is the pattern which I'll come to in terms of diaspora, that there are lots of connections that are at the moment essentially unsupported and individual. We've heard that all health boards and trusts are signed up to the International Health Charter for Health Partnerships. And yet there's incredibly varied leadership across the health boards in terms of who is involved in that. So in some, it's somebody at board level, in others, it's a jobbing clinician. And really, you need someone at a high level to take part in this, to engage the board of the health boards, the boards of the health boards, and to lead development of these services, and to be engaged in groups like the Charter Implementation Group, and not to leave that at the lower level and leave people who already have busy clinical jobs also trying to drive forward the profile of this work. And a strong feeling came through from the stakeholder interviews that although there's great enthusiasm within the NHS, clearly, and when you discuss this with people, they support it, is not the core business of the NHS. And of course that makes sense. And we know the pressure that the NHS is under at the moment. And it's incredibly difficult, I think, for health boards to say, oh yes, we want to give people leave to go and work in other countries, or to support their partnerships when there aren't enough nurses or midwives or doctors perhaps on the wards. The exception here is Public Health Wales, which has an international health strategy, various international health groups, and strong links internationally, particularly through its WHO coordinating centre with Europe, but also beyond, and has a high profile internationally. And it's a lack of time, it's a lack of resource, and all of these health partnerships are run by volunteers, and that's how it should be. There should be voluntary work, but at the same time, their work will inevitably be limited without additional support. And there's also limited monitoring and reporting of this activity, which would show the benefits that are coming back to the NHS, which are on the next slide, and which will help support NHS organisations in seeing the value of this and putting their efforts into supporting it. Different health boards have different fund holding policies for their health links, and that also has a surprisingly large effect on the work. So I know from working in Betsy Cadwaladr Health Board that our Betsy's charitable arm will hold funds for the health links, and that gives us all the support of their accounting, of their policies, and that's a real help for applying for funds as well. I know some other health boards don't take that approach, even though in a sense all of those organisations have the same policies. They interpret them in different ways, and some feel that international work doesn't fall under their remit. And that leaves health links for those other health boards struggling to set up their own financial systems and the governance that's required around that, particularly for funding bids. And the NHS, Wales in general, but the NHS in particular, is full of people from the four corners of the world. So we bring people into the NHS to work from so many other countries. Many of them have fantastic links. Many of them are working in terms of health with colleagues or friends or family in their other countries, and setting up their own individual links. And we're not capitalising on this at the moment. So there are some diaspora-led health links in Wales, and there's lots of other activity going on that's led by people from other countries. But we could really make much more of this in terms of using people who already have the expertise and the connections to build this work and to lead it forwards. And as I've already mentioned, in terms of monitoring and reporting, there's not really coherent work to capture what the benefits are to the NHS and its workforce. And if we move on to the next slide, we know there are benefits for our NHS. And at this time, when the NHS is struggling, although it's difficult to think of allowing people time to do this sort of work or to focus on this type of work, the benefits are there for the taking. And at a time when staff need support, is it actually a perfect time to show support for this type of activity. So people who are involved in this work develop personally, they develop professionally, so they gain skills, and particularly leadership skills, but often clinical skills as well, and experience dealing with different resource settings and ideas and innovations that come from that. And because they're doing it mostly in their own time and gaining themselves from it in terms of satisfaction, it's incredibly cost effective from an organisational point of view for professional development. And they bring those benefits back, and it affects their work. And everyone I speak to who's involved in this type of work reports those sort of benefits. That helps recruitment and retention. So arriving at a workplace that offers these type of opportunities, and thinking about HEIW offering overseas opportunities for trainees, for nurses, for midwives, attracts people to apply for jobs, and will help NHS Wales attract the staff that it needs. There are vacancies everywhere, not just in Wales, across the UK. And it helps to retain staff. And if that's tied to innovative contracts and so on, that can support ethical recruitment from overseas, for example, by supporting people who have joined the NHS from other countries to maintain those connections and to contribute using some of their NHS time. Innovations certainly can come back from overseas to the UK NHS, to NHS Wales. And if we properly involve diaspora healthcare staff in this, value their expertise, value their connections, value their knowledge in this respect, not only does it help Wales's global health activity, but it also helps foster the inclusive culture that the NHS needs to develop and to improve on at the moment. And overall, we at THET believe, and are currently inquiring as to whether we can find evidence of this, that overall being involved in global health, for those who want to, improves well-being. And again, at the moment, with the pressures on NHS staff, supporting well-being through a raft of measures is, of course, incredibly important. Next slide, please. And Wales itself benefits. So if the NHS benefits, then that becomes stronger for the benefit of the country. So much work going on that could raise Wales's profile, and in some cases is, but a lot of it is perhaps not celebrated as much as it could be, and not trumpeted as much as it could be. And I think sometimes when we see the good work, we talk about it in Wales, and we say we're punching above our weight, but we somehow don't have the confidence or the connections or the something to properly project it out there and say, here we are, we're Wales, we're doing this, isn't that amazing? And with that, create the connections that allow the soft power and the influence with which we can take forward those very Welsh values of global citizenship and sustainability that are in the Wellbeing of Future Generations Act, and the global responsibility that comes as part of that. Next slide, please. Which is one of the 7 goals of the Wellbeing of Future Generations Act. It's the title of this conference, and I know there's a whole session later about Wales's global citizenship, so I won't labour that any further. But if we don't make the most of the work that we're doing, then having that goal is almost just lip service, really. And so that cycles me back to Wales and its strengths as a community. So we are a proud nation, one that's retained its culture, that's developed individuality through the Senedd and through its legislation, and which does function as a community. And one of the aspects of the second report is looking at how COVID, I snuck in an extra picture here of the pesky coronavirus, how that's impacted all this work. And it's disrupted things massively, of course, not least through the enormous pressure that the NHS is under still. But it's also in some ways brought people together, and a lot of people spoke about how in Wales it was relatively easy to transform some of the healthcare and other commercial sectors into producing PPE, and how, having put out that call, those companies just responded because they wanted to do something for the country. And I benefited from that myself, working in intensive care in Glenclwyd, where we were wearing visors made by the Royal Mint in Llantrisant. I still don't quite understand how they did that, but there we go. But of course, coronavirus also affects the implementation of these recommendations. So if we move on to the next slide, which is what happens next. There's very little there because we don't know yet. And unfortunately, Dr. Atherton's already talked about this. So the reports are with the Welsh Government, they're considering them, they've received them positively. At the moment, given the pressure that the NHS is under, they're uncertain to what extent they can introduce anything new to the NHS. I would argue that there's so much there already that simply needs to be put into practice. There's an implementation gap between what's already intended and what's actually happening that could be quite easily implemented with very little extra resource to the benefit of people right now when they need that support in other areas as well as in their clinical work. So what we're doing is the steering groups for the two reports are meeting with Welsh Government to discuss the contents and where we think things could go next, and then we see what Welsh Government would like to do. Clearly, Welsh Government is keen to put things in place so that when the time is right in terms of those NHS pressures and the general situation in the country, we have perhaps better structures so that we can take things forward more quickly. And I know that, for example, HEIW, even aside from these reports, is working on its international strategy and what it can do to improve opportunities within Wales. And one potential is for Wales and Africa Health Links Network, I have to mention because it's their conference, to play a bigger role here, because they do sit outside the NHS. So they're in a brilliant position with their NHS connections, NHS knowledge, but themselves a voluntary group and therefore very little capacity to do anything, with funding for a staff member to put some of these things in place and to start supporting this outside of the NHS and its pressures, and they have made a proposal for that. Next slide, please. So I think I just finished by saying thank you for listening. Thank you to everyone who has supported this project. So, of course, Wales and Africa Health Links Network, the entire group who supported the first report, and all those stakeholders, some of you who are here just now, who contributed in one way or another to the reports. And I'm happy to take any questions that are there or have any discussions from here on.
Thank you ever so much, Kit. You're always very clear in your presentations, and excellent pieces of work on both those reports. And I'm just thinking that the number of people that engaged with you as stakeholders through those reports, and the amount of interest and commitment and passion across Wales for this is really significant. And for this conference, we've had almost 200 people registered. We've got 60 people here now, which is way above our expectations. So it just goes to show that there are a lot of people interested in what we're doing. And you're right, as the Health Links Network, we're a small bunch of volunteers as a charity. We would love people to get involved with us. What we would like is to engage with NHS and higher and further education sector as we put the building blocks together for what we do in the next step. So get more bold and more ambitious, as Frank Atherton has said. So if anybody here is interested in getting involved with us, particularly if you've got connections within HEIW or the IHCC, where we think the capacity may be there to build on this. At the moment, the engagement is largely with the rest of the world, mostly Europe and the US, rather than with sub-Saharan Africa, which is obviously our interest. So it's increasing their capacity to be able to do that as well. And also of course, the health board. So anybody, please do get in touch. We have got a couple of questions for you, Kit. I think there's one from Zed Sabanda. Now, Zed, would you like to come and ask the question yourself? We can bring you on to the stage to ask your question. You know, Kath, are you able to bring Zed on?
Yeah, I have them. You should have a invitation, Zed, to pop up, or you could take yourself off mute.
I can start. I can start discussing that, and if Zed appears, we'll hear from him. But I've posted in the chat a link to THET's policy report about exactly that, and I think I wouldn't describe it as a reluctance. It's not that people are saying, "Oh no, we don't want to involve these people." It's more. I think it's probably more a symptom of the lack of inclusivity and the lack of recognition. And the reason I've put that link in the box is that it's a complex area, and I think it's multifactorial. But THET has examined this in a policy report that was published in August this year. And in fact, Wales and Africa Health Links Network are planning an event about this particular topic. And the many reasons why the expertise of diaspora staff is overlooked. And it's caused me to wonder myself why Glenclwyd has a link with Ethiopia when, as far as I know, there are no Ethiopian staff in the hospital, but there's certainly a staff from many other countries. Perhaps there were when that link started, but it's paused for thought. Hi, Zed.
I just put two quick questions, actually. The first one, actually, I just wanted to get an idea whether you found that what was the reasons for this reluctance for links to use the diaspora expertise that's available in Wales?
Yeah, so, and I think it's not. I don't think it's a reluctance as for the links to use them. I think it's the confluence of all the barriers to diaspora staff being recognised, being valued, getting involved. I think, and you know yourself, I think many diaspora staff are doing lots of work already in this regard in an informal, individual way that simply isn't picked up within their organisations or by other people who are taking part in this. I certainly heard from people I spoke to of particular barriers like the international development sector, for example, being too white and feeling unwelcome in international development circles, which is something that, of course, we all have to look at, and which Hub Cymru Africa are doing fantastic work on, I think, and which THET have started to address in recent years as well. But I think it's not, I wouldn't describe it as people being reluctant to involve these staff so much as just a whole lot of barriers which are facing diaspora staff in general, I think.
The other quick one is about the good practice in Betsy with their use of charitable funds. I'm also aware there's another health board like CUMTAF that has Pennies for Heaven. Do you feel that if this is recommended as good practice, a lot of other health boards would do the same?
It seems to be more complicated than you would expect. So one of the recommendations in the report is that the charitable organisations, I forget the word I use, but implement the same policy as Betsy and some others are. It does seem to be about interpretation, because those health boards charitable funds have to be used for the benefit of the local population. And so Betsy Cadwaladr sees the benefits to the NHS staff of being involved in this work and says, well, if our staff are benefiting, then the NHS is benefiting, and that's good for our local population. And some other health boards see it as, well, this is international work, that's not to do with our local population. So what I was advised by someone working within this was that it would be possible for Welsh Government to work with the Charities Commission to put together a good practice statement that the charitable organisations could work towards. But I know it's about interpretation, and I think it's also about experience, and the old health board having had negative experiences with funds that have been spent abroad. But certainly those who are happy to use their funds in those ways see it as good use of their time and their charitable experience.
Thank you.
Thanks, Kit, and thanks, Dr. Zed. We just have, I think, time for one more question, if that's okay, before you open the polls. So Paul Myers has asked, how can individuals and organisations encourage Welsh Government to implement your recommendations, Kit?
Sorry, Kath, what was that?
How can individuals and organisations encourage Welsh Government to implement your recommendations? Yeah, good question.
I think it depends what sort of organisation we're talking about. So I would encourage those within the NHS to highlight this at all levels within their organisation. And that will depend, of course, where they're working and how they're working, what sort of influence they can have. But it might be within their staff group, it might be highlighting it to their manager. They may be able to contact the board directly. All health boards should have an international health lead. I have to say that for this report, there was one health board that I wasn't even able to identify that person, but they are identified in all other health boards. So I think lobbying within your own organisation to say this is important, look at and to point out what's in place already. So if you're working in a health board, it's signed up to the Charter for International Health Partnerships, which recommends that they give special leave for staff to take part in these activities, which has recommendations on setting up partnerships, on governance, on organisation. And so simply lobbying your organisation to implement those, I think, would be useful. In terms of Welsh Government, we are engaging with them, and we hope that it will be possible to put some of these in place. But I suppose aside from that, the way of influencing Welsh Government is through your MS. So that's always an option, to get in touch with your MS and say these reports have been published. I think this is really important. Please use your influence within Welsh Government to have these taken forward. But recognising that those in Welsh Government who've been involved with these reports are enthusiastic about this work. It's not that there's a barrier. There's not a barrier to wanting to do this better. I think it's even within the government about time, capacity, and time, and particularly with the pressures that people are under.
Brilliant. Thank you very much, Kit. Whilst Catherine gives the closing remarks, I just want to say that I'm launching the poll, so it should be popping up on the right-hand side. If you could share with us how you've experienced these sessions, it really does help us. Thanks, Kath, over to you.
Thanks, Kath. And thanks again, Kit. And I'm sorry, I know there were a couple of other questions, but we are coming to the end of the session. And thank you so much for not only presenting, but for all the work that you've done on these reviews and reports, and particularly the support that THET has given to the Wales and Africa Health Links Network, well, for many years, but more intensively in the last couple of years. So I think the Chief Executive of THET might be a participant, might be in the audience. So Ben, a call out to you. Thanks very much for all your support to us, because we are just a small bunch of volunteers, and THET is kind of our sister organisation that we really rely on. So it's a seminal moment now in terms of taking forward what we found in the reviews that Kit has done. So I'd encourage everybody to go and have a look at them, have a read of them, and think about what you could do to help us get these implemented. And Kit has put some very good ideas out there, but it is essentially about lobbying, because we've made the case. Welsh Government is very supportive, and throughout the NHS we've had nothing but support from senior managers and leaders. So the will is there. It's just how we put things in place. As we go through this really difficult winter and the next few months, how do we put things in place so that we can change and develop how we do partnership working in the future and really up our ambitions. So anything that you think of or that you'd like to get involved in, do get in touch, but have a read of the reviews. I'd strongly encourage you to do that. So we do have a website, so you can always Google Wales and Africa Health Links Network, and we try and keep that up to date with any information. All the recordings from the conference will be on the YouTube channel, so you can watch all these again. We'll try and share some of the slide sets if we can. We'll just need to do a bit of checking on that, but if people want that, we will look into that and do our best. So before I wind up now, I know there's a poll that Kath has put up just for feedback, which is helpful for us. And also to say that the next session, you've got a bit of a break now to have a coffee and a flapjack if you like, but we're delighted that at 12 o'clock we've got the Minister for Social Justice, Jane Hutt, speaking to us, who has been a patron of the Wales Africa Health Links Network, has herself started up a partnership with partners in other NGOs in Uganda, having spent a lot of her childhood in Uganda. So she's a passionate supporter, and it's just wonderful that Wales has a Minister for Social Justice. How many other countries have got a Minister for Social Justice? So please do come and join us at 12. Then at 1 o'clock, we've got a session on global citizenship, a potted history, which I think is going to be absolutely fascinating. And Craig Owen has done a lot of research in Wales's place in the world and the sort of progressive internationalism that's always been there, like a golden thread in our recent history. So that's going to be a history lesson with a difference. Will be fascinating. And then at 2:30, Dr. Zed Zabanda, who you saw just now, is leading a session looking at the impact of COVID-19 in Wales and sub-Saharan Africa, with a particular emphasis on vaccine hesitancy and vaccine uptake. So that would be absolutely fascinating. And then at 5 o'clock, we've got an informal networking. So anybody who's involved in health partnership working or has an interest in health partnership working, then please just join us then. And we will make sure that we do it in a way that everybody can see everybody else. So we'll use the tables if you've had a look around this session, we'll use one of the networking tables so people can see each other and share what's been happening in the last few months and what their plans are in the future. So it just leaves for me to say thank you very much to the Help Cymru Africa team. We've tried out a new platform. So far, it's working okay. And thanks again to Kit Chalmers and to our colleagues from THET. So I'll see you shortly at 12 o'clock. You've got time for a bit of a break, check those emails and then be back at 12. Thank you very much, everybody.